Hello and welcome back as we talk now about the chief complaint versus the problem representation. And these are essential components of clinical reasoning and being able to come up with the differential diagnoses and the final diagnosis. Let's compare the two. A chief complaint, by definition, is the primary reason a patient is seeking care. And oftentimes, you might even see it documented as reason for seeking care. And it's expressed in the patient's own words. It's just providing a brief summary so that the healthcare provider can understand why the patient is there to seek care. It's often just talking about single or maybe a couple specific symptoms or concerns that prompted the visit, and it's usually very brief and concise. We try to limit it to no more than just a few words or even a short phrase, and oftentimes you might even see it in quotations. So let me give you a few examples. If a patient comes in with chest pain that is relieved by relaxation and reducing activity, we might not put all that information in there. We might just say the chief complaint is chest pain. If someone has a headache for 3 or 4 days and it's exacerbated by insomnia and trying to decrease coffee intake, well, for your chief complaint or reason for seeking care, you're just going to document headache. If a patient is complaining of cold-like symptoms like cough for several days and they've tried um, over-the-counter medications, in your chief complaint, you're going to write cough for 2 days. So remembering that the purpose is to serve as just the starting point of further inquiry that you're going to unfold as you get more focused information while you're taking in-depth patient history. Things that you would include in this in-depth patient history are things like the duration, the context of the issues, other potential causes, when did it start? And you can do this by using the old cart mnemonic to build your history of present illness. So then what is problem representation? By definition, this is a structured summary providing a more comprehensive and synthesized overview of the current problem. And what it does is it translates the chief complaint into a more detailed context. And so this sometimes is often referred to as the history of present illness. Okay, so think about problem representation and history of present illness being very similar. It's broader, more detailed, and it includes important characteristics like the onset, the duration, location, the progression of symptoms, associated symptoms that you might need to rule out as you go through all the different systems and potential tangential um, manifestations. You might even need to review relevant medical history, social history, and even family history during this time. During problem representation, a clinician would even go through and talk about potential risk factors. So, in terms of the level of detail of the problem representation, this is going to be more detailed and structured than your chief complaint. And it's capturing the essence of the overall clinical issues. This is going to help you provide enough information to start forming a differential diagnosis in the back of your mind until you're able to do further examination and diagnostics. So let me give you an example. The patient that we said had a chief complaint of chest pain. For the problem representation, perhaps we expand and we say a 55-year-old male with a history of hypertension, smokes presently, and has a 3-hour history of sharp substernal chest pain radiating to his left arm and is also associated with shortness of breath and diaphoresis. That would be a beginning of a good problem representation. So the purpose again is to help clinicians organize all the clinical data, identifying key features, and begin generating a hypothesis for the differential diagnosis as the patient is giving you subjective information. This is also a time where you will want to ask clarifying questions and try to figure out in what context the information fits. So again, remember to review the key differences between chief complaint and problem representation.